Today, we're going to talk about the drugs used in urinary tract infections. During the course of our discussion today, we're going to talk about the introduction, we're going to talk about the spectrum of UTIs and the drugs used. So we begin with discussing what is UTI. UTI or urinary tract. Infection. Okay, so urinary tract infection basically refers to when microbes begin to adhere, and after adhering they begin to multiply, and they continue to occupy the UTI, the urinary tract, and in the process bringing, causing signs and symptoms in the patients. Okay, so that is basically what is UTI. So how can we define UTI? We can say it's the adherence, the multiplication, and the persistence of an infectious agent within the urinary tract. Okay. So then, what is the urinary tract? Okay. So let's try to represent the urinary tract diagrammatically. So we know we have got two kidneys. Let's say that is one kidney, and this is another kidney. So let's call this the right kidney. And this is the left kidney. Okay, we have got these tubes coming from the kidney, and these tubes enter into the bladder, and the bladder in turn opens into the urethra. Okay, so let's label all these things. So this is the ureter, this is the bladder, and that is the urethra. And there are valves here. Let's label that valve is the vesico ureteral valve. Okay, so this valve basically prevents the urine from going back into the ureter and from there into the kidney. So that is this valve, vesico-ureteral valve. Okay. So this is the urinary tract. So the kidney and all these tubes bringing out the urine from the kidney, all those form the urinary system, and the urinary tract itself is the tubes, the bladder that form part of the urinary system. Right, so the urinary tract is divided, for the sake of study, into two parts, which we're going to draw here. So let's take this as the cutoff point. Okay, so let's draw the slide like that. So anything below this is the lower urinary tract. Lower urinary tract. Anything above the line is the upper urinary tract. Okay, so the upper urinary tract is made up of the ureter. Okay, we have the ureter and we have the kidney itself. And the lower urinary tract, we have the bladder and we have the urethra. Okay. So infections, we have got the suffix itis. Okay. So if it is an infection of the ureter, we call it ureteritis. Okay. Inflammation of the bladder. Okay. Bladder, we call it cystitis. Okay. And of the urethra, it is urethritis. Okay. And in the kidney, when the pelvis is involved, we call it pyelonephritis. Pyelonephritis. Okay, so the inflammation of the kidney is pyelonephritis, of the ureter is ureteritis, of the bladder is cystitis, and of the urethra is urethritis. Okay, so these are basically inflammation of the lower urinary tract, and these are inflammation of the upper urinary tract. Okay, so this is our urinary tract. So the infection of the urinary tract is the urinary tract infection. Okay. Now let's add some more details here. Now, if it is a male, we have the prostate. Okay, so the prostate would be seen in males. Females don't have the prostate gland. Okay. Now, urinary tract infection, from now on we would be using this acronym for urinary tract infection. Urinary tract infection is said to be complicated Okay, it is said to be complicated if there is a structural or functional abnormality of the kidney. So if there is any functional abnormality of the kidney, along with a urinary tract infection, we call it a complicated urinary tract infection. So non-complicated is complicated. There is no structural or functional abnormality of the kidney. So UTI will be mostly complicated or non-complicated. For the purpose of this lecture, we are going to concentrate on non-complicated UTI. Okay, so this is the purview of this lecture. We'll be talking only about the non-complicated UTI. Now, urinary tract infection, we said it is an infectious disease. Infectious disease. Now, because it is an infectious disease, there is something called a epidemiological triad. So there is an epidemiological triad, meaning there are three factors that are involved in the pathogenesis of the disease. One is the agent, the other is the host, and the third one is the environment. So in the pathogenesis, there are three things which are involved in the pathogenesis: the agent, the host, and the environment is involved in pathogenesis. Pathogenesis of the disease. So patho means disease. Genesis means origin. So origin of infectious disease, there are three factors which are involved: the host, the agent, and the environment. Now, this an agent is the infectious agent, which may be, as we're going to discuss, microbes. And the host is the human being. And the environment is the local environment. In this case, if it is urinary tract infection, we are talking about the perianal and the vaginal region, or the penile region of the human body. That would form the environment. So in an infectious disease, we can intervene at the level of the agent. Meaning we can use drugs against the agent, or we can modify some things in the host. For example, the behavior of the host. If the host is having a highly risky sexual behavior, and that behavior is modified, then the risk of that person having UTI decreases, because sexual activity is one of the risk factors for the infectious disease, the urinary tract infection. Okay. Or we can modify the environment. For example, if the woman who is having UTI is using lots of toiletries like antibacterial washes, which changes the flora of the vagina, then she would be at higher risk for having a UTI. So that environment itself, if she stops using the antibacterial, say, soap, then she can reduce her risk of having UTI. So the environment can be modified. So that is the intervention that can be done for a UTI. Okay, but this lecture, we are only going to focus on the agent. We are going to look at drugs used in UTI. Okay, so we are not going to talk about the host, what can be modified in the host, or how the environment can be modified. So this is the purview of our lecture here. Okay. So the UTI itself can be symptomatic or it can be asymptomatic. Okay, for example, asymptomatic bacteriuria. Okay. Asymptomatic meaning the patient is not feeling any symptoms. But if we culture the urine, then we find that there is bacteria. Okay, so that is asymptomatic bacteriuria. So if it is fungus, then that is a asymptomatic UTI caused by fungus. Okay, so it can be viral as well. Symptomatic is when the patient feels some symptoms. And what are the symptoms that we are going to talk about? Those symptoms are the clinical features of UTI. Okay, so what are symptoms? Symptoms, when we say symptoms, so symptoms means what the patient is experiencing. Okay, so that is the symptom. The symptoms that is seen in UTI is what we are going to see now. So the symptoms that the patient usually has is the patient has increased micturition, meaning increased urination, and the patient also feels increased urgency. Okay, so that could be one of the clinical features of UTI. The second clinical feature that patients present with is they present with dysuria. Okay, so dysuria is basically pain on micturition. Okay, so the difficulty in urination is what we call dysuria. The patient feels pain on micturition, and this pain is often described as a burning pain. Burning pain. Okay, so that is the one of the clinical features of UTI. Third presentation is pain. The patient complains of pain, and it is localized to the suprapubic region, meaning just above the pubis. Okay, so and this pain is before and after micturition. Okay, so both before and after voiding, the patient usually complains of pain. And the other presentation is there is an intense desire to urinate. Okay, so there is an intense desire to urinate. So this is attributed to the inflammation of the inner wall of the bladder. Okay, so this technically it is called strangulation. Okay, so the patient's presents with, they say there is an intense desire to urinate, and which is not the normal feeling. And the urine itself is found to be cloudy at times, and there is an unpleasant odor, okay, which is very apparent. And sometimes patients complain of hematuria. What is hematuria? It is the presence of blood. And this may be either visible or it may be invisible. Okay, so sometimes only when you do a biochemical test do you detect the presence of blood. So this is the classic clinical features of UTI. Okay. So on further analysis, it is seen that these features is seen in lower UTI. Okay. So it is seen, what do we mean by lower UTI? We are talking about what inflammation? We are talking about urethritis and the bladder cystitis. Okay, so these are the clinical features of urethritis or cystitis. So what about pyelonephritis then? So we said that we have got this kidney here, we have got the bladder here, and we have got the urethra there, and we have the ureters here. The infection of the kidney, we said we have called it pyelonephritis. Okay, so pyelonephritis, in addition to the above symptoms, it also shows some other features. Okay, so in addition to the 6 clinical features that we have discussed, it also shows in pyelonephritis there will be fever, there will be rigors, sometimes there will be vomiting, hypotension, and pain in the loins. Okay, so if we take a history accurately, then we can eliminate pyelonephritis from we can distinguish between pyelonephritis and urethritis or cystitis. So usually pyelonephritis presents in that way. Okay. So those are the clinical features, the symptoms, let's say. Symptoms of UTI. And here we have the symptoms of pyelonephritis. Okay. Symptoms of UTI and symptoms of pyelonephritis. Now, we said we are going to talk about drugs which are used in UTI. Now the question is, what happens if we don't treat? What if we don't treat? Okay, so what would happen if we don't treat? So what happens is, this infection usually comes up, means it ascends from the urethra, reaches the bladder. From the bladder, the infection ascends into the ureter, and finally it enters the kidney. So we have urethritis, which ascends into the bladder, causing cystitis. Then it enters into the ureter, causes ureteritis, and then it reaches the kidney and it causes pyelonephritis. Okay, so then the infection enters into the kidney. So what happens from the kidney is, the kidney is richly supplied with blood vessels. So this infection can enter into the bloodstream. It can enter into the bloodstream, and in the bloodstream it can multiply, and then what can it cause? It can cause sepsis. Okay, so if UTI is not treated, it can have major consequences like sepsis, and sometimes it can even be life-threatening. Okay, so that is the reason why there should be an intervention for UTI. The other thing that could happen is, in women of reproductive age, it can even cause complications with pregnancy, okay, and fertility. Okay, so what are the causative agents? So let's look at causative agents for UTI. Okay, so the causative agents could be, so depending on the cause, we can classify. The source of the causative agent could be from the community. Okay, so UTI can be had from the community, or it can be hospital acquired. Okay, from the community, it can be spread by, say, infectious agents like bacteria. What could be the examples of bacteria? Could be like the most common one could be from the contamination from the fecal matter, and usually the organism that is involved is E. coli. Okay. Or it can be Proteus mirabilis. Klebsiella, pneumoniae, or it can be Staphylococcus, Saprophyticus, or it could be Enterococcus fecalis. Okay, so it could be the most common bacteria which causes UTI are E. coli, Proteus mirabilis, Klebsiella pneumoniae, Staphylococcus saprophyticus, Enterococcus fecalis. Or it can be a fungus. Okay, and the example would be Candida. Candida species. It can be Cryptococcus. Or it could be some Trichosporum species. Okay, it could be Trichosporum. So those are the most common fungi which causes. The other thing that could be would be viruses. Okay, and what are the common viruses that cause? So there is a virus called BK virus. Okay, and there is sometimes adenoviruses and sometimes cytomegalovirus. Okay, this could also cause UTI. So what about hospital acquired? Hospital acquired is if suppose you have you are instrumented. Okay, so if there is instrumentation, meaning like if the patient is instrumented with say a catheter, okay, like a Foley's catheter, okay, which is used to drain the urine. So if the patient has got an indwelling catheter, then the patient can become susceptible to UTI. Okay, so UTI can be acquired from the community, it can be acquired from the hospital. Okay, the other thing to remember is when we talked about, we said about the kidney again here, about the bladder. Okay. So we said one mode of having the infection is by ascending. There are ascending infections. Okay, so from the urethra it moves up into the kidney. So one route to getting an infection is as an ascending infection, or we said the kidney is supplied with blood vessels. So if you have got a systemic infection, it can come from the blood, it can enter into the kidney. So there can be a hematogenous infection. Hematogenous infection. So from the blood, it can enter into the kidney, and then it can come down. It can enter into the ureter and bladder, and subsequently the urethra. So there can be a hematogenous infection as well. Okay. So the important thing to remember here in the community acquired infections is usually fungal and viral infections are seen when the host is immunocompromised. Okay, so if the host is immunocompromised, then the chances of fungal infections and viral infections is very high. So when does the host become immunocompromised? Suppose the patient is has undergone transplant, say a solid organ transplant. Okay, so the patient would then be on immunosuppressants, and in which case the patient becomes more susceptible to viral and fungal infections. So if it is an immunocompetent host, in an immunocompetent host, the most common infection is the bacterial. Okay, so that is why in most of the textbooks, the drugs for UTI is limited to antibacterial drugs. Okay, so in the immunocompetent host, the most common UTI causing organism is bacterial. Okay, so antibiotics are seen most commonly in most of the textbooks. Okay, so now we can say what is the cause of UTI. Cause of UTI. Okay, so there is a mnemonic which is usually used to understand the causes of UTI, to remember. Okay, so the mnemonic is, let's write it down here. The mnemonic is hard to void. Okay, so this is used as a mnemonic. So let's capitalize this here. Hard to void. So if we know this mnemonic, we can basically explain what are the causes of UTI. Okay, so let's take this down one by one. Age. Age refers to the hormonal changes. Okay, so what hormonal changes are we talking about? It can be caused by pregnancy. It can be caused by menopause. Okay, where there is loss of hormones, or artificial hormonal changes like using birth control hormonal pills. Okay. Hormonal pills. Okay, so those can cause hormonal changes. So what's the significance of changing the hormones? So these hormonal changes can lead to changes in the normal flora. Okay, in this case we are talking about the vaginal flora. Okay, so in most of this, our discussions on UTI, we are going to talk about the females now. Why is that? In females, there is increased prevalence of UTI. Okay, why? Because of anatomical reasons. Okay, so first thing is that the urethra is very short. Again, because the urethra is short, not only is it short, it is near the anal, near the anus. Okay, so as a result, if the women suppose wipes from the back to the front, then the organisms near the anus will be wiped to near the urethral opening. And since the opening is short, it will directly enter. It has got ample chances to enter and become an ascending infection. Okay. Or if the women is, having tight undergarments, using contaminated tampons, so there is chance for increased risk of UTI. Okay, so yeah, and so in the women, the vagina is populated by a normal flora. The most important normal flora is lactobacilli. Okay, so this lactobacilli, it thrives in somewhat an acidic pH, and it kind of prevents the pathogenic bacteria from growing. Now, if there are hormonal changes, those can interfere with the normal flora, and that will make the person more susceptible to having UTI. Okay, so the second letter here is A. Okay. And A here refers to antibiotics. So antibiotics, they are targeted at pathogenic organisms, but they also can kill the normal endogenous flora. So the normal endogenous flora it is technically called the microbiome. Okay, so the antibiotics are targeted at pathogenic organisms, but these antibiotics also kill the normal endogenous flora. Okay, and that can, again, as we previously discussed, can cause the person to be susceptible to UTI. Okay, so the antibiotics that are implicated are usually broad spectrum antibiotics have got a heightened problem. Okay, broad spectrum antibiotics have got this problem. Okay, so the next word here is R. And R here refers to renal stones. Okay. So if we, let's draw it again here. Okay. So the urine is flowing down and out of the urethra. Now, if there is an obstruction, okay, suppose there is an obstruction to the flow of urine. The obstruction can, let's say here, in the kidney there is a stone here. Okay. In the bladder, suppose there is a tumor. Okay. All this can cause an obstruction to the flow of urine. So if there is an obstruction to the flow of urine, what happens? If there is an organism that is climbing up here and it is reaching here, and because of this obstruction here, the urine that is coming will not wash it off. Okay, so this one will not come out. It will continue to occupy this particular area, and that will make the person susceptible to UTI. Okay, so renal stones or obstructions, okay, like tumors, they can cause UTI. Okay. So the next word here is D, and D here refers to diabetes. So if the person is diabetic, there is lots of problems. There is interference with the blood flow. As a result, the renal blood flow will be changed, and as a result, the voiding volume may change. Okay, and maybe glucose may be, say, glucose may be voided in the urine and making the urine a very happy place for the bacteria to grow. And we said there can be changes in blood flow. There can be blood flow changes. So if the blood flow in the kidney changes, then the urine flow will also change. And then there can be problems with the musculature of the bladder. So the tone, there can be difference in the tone of the bladder. Okay, all this can interfere with the flow of urine, and that can make the person susceptible to UTI. Okay, so the next word here is T, and T here is toiletries. Okay. So meaning all the antibacterial soap that people use, okay, those can make the person susceptible to UTI. So the advice would be not to use all those containing antibacterial substances, okay, and limit to toiletries which don't contain antibacterial ingredients. Obstruction, O refers to obstruction. So we have already talked about obstruction due to the tumor. Okay. In the males especially, suppose somewhere there is the which gland, which is found only in the males, that's the prostate. So if there is an enlargement of the prostate, okay, if we look anatomically, if the prostate grows, there is not much space near the prostate to expand into. So it kind of tries to expand inwards. As a result, it will squeeze the urethra. Okay, and that can cause, again, obstruction to the flow of blood. So the volume of fluid that is voided will reduce, and it can again make the person susceptible to infection. Okay, so yeah. Then there is something, V is vesico ureteral reflux. Okay, so when we looked at the anatomy, we said that there is a valves here, the vesico-ureteral valve. Now this valve, if there is a compromise in the valve, this valve is actually preventing the urine from going from the bladder into the ureter, okay, and thereby to the kidney. Now if there is a problem with this valve, this is a one-way valve. So if there is a problem with the valve, then it can cause a vesico-ureteral reflux. So the chances of having UTI increases, and that is the reason why small children have got an increased susceptibility to UTI, okay, because in them the vesico-ureteral valve is not fully functional. Okay, so as a result, there is always reflux of urine back into the ureter, okay, and they are more susceptible to UTI. Okay. And the next O here is an overextended bladder. Okay, so we said if the tone of the muscle changes, and this happens in old age or bedridden patients, they have got this problem with the overextended bladder. As a result, the urine flow again decreases to a trickle. Then they are also more susceptible to infection. Okay, so people in care homes, they usually present with this problem. The I is instrumentation. Okay. Instruments like we said, indwelling catheters. Okay. So catheters, they actually provide a good surface area for the microorganisms to grow. So if these indwelling catheters are not changed as per the protocols, then there is chances of the people becoming susceptible to UTI. And the D is decreased functioning of the immune system. So if the immune system is compromised again, the immune system usually keeps the microorganisms in check. So if there is a problem with the immune system, then the person can become more susceptible to UTI. Okay, so these are the causes of UTI. Okay. All right. Now let us discuss the intervention that we were talking about. We talked about the epidemiological triad. We said for an infectious disease, we can intervene at the level of the organism or the host or the environment. Okay, we are going to talk about intervention at the level of the organism. Okay, so these are the drugs for UTI. Okay, so this is an intervention targeted at the organism, at the level of the organism. Okay, so we are not going to talk about what we can change in the host or what we can change in the environment. We are going to look only at how we can target the organism using drugs. Okay, so the drugs itself, drugs used in the treatment of UTI, we can classify these drugs into urinary antiseptics, can be antimicrobial agents, and if you remember, we said the patients usually present with pain, and so analgesics. Okay, so these are the most common classification of drugs used in the treatment of UTI. So that's the most important analgesic that is used for suprapubic pain is phenoxypyridine. Phenoxypyridine. So that's the analgesic. Why are we giving this analgesic? It is for the suprapubic pain. Okay, so there is another agent which we will talk under urinary antiseptics called methenamine. That methenamine also decreases pain, the suprapubic pain, and so those are the analgesic drugs. So let's look at urinary antiseptics. Okay, so what are urinary antiseptics? Basically, urinary antiseptics are drugs which attain antibacterial concentration only in the urinary tract. Okay, so what are urinary antiseptics? Urinary antiseptics are drugs which attain antibacterial or maximum concentration only in the urinary tract. Okay, so therefore they are useful only for lower urinary tract infections. Okay, like what? Urethritis and cystitis. Okay. So they are not useful for pyelonephritis. Okay, so what are the drugs that we are talking about? We are talking about the most important urinary antiseptics are nalidixic acid, then there is nitrofurantoin, We talked about an analgesic agent which was also a urinary antiseptic. What was the name? Yes, methenamine. Then there is phosphomycin. This is an F here. Phosphomycin. And there is another one called mandelic acid. So we have got okay, 5 urinary antiseptics. Okay. Yeah, they have got some advantages also. What are the advantages? They decrease let's say, suppress normal bacteria. Then what do? They decrease the rates of resistance. They decrease resistance. Okay. And they decrease yeast overgrowth. Okay, so what happens is the bacteria and fungus, they are constantly at war with each other. So as a result, if you decrease bacteria, what will happen? Fungus will increase. Okay, but the urinary antiseptics, they decrease the fungal overgrowth. So they decrease the most common yeast, which is candid organisms from overgrowing. And then they have got another advantage. They decrease the teratogenic and fetal toxicity. Okay, so yeah, so in pregnant women, it has got some advantage. Okay, so let's look at some of these drugs in detail. So nalidixic acid, let's talk something about nalidixic acid. So nalidixic acid, it is synthetic. That is why we have written, if you remember the classification, we wrote antimicrobial. Okay, so this is basically an antimicrobial agent. Okay, it's not an antibiotic as such because it is synthesized. Okay, it's a synthesized chemical. So it is having limited bactericidal action, and it is used basically it's also used for chemo prophylaxis. Okay, so what is prophylaxis? It is prevention. It is an inhibitor of DNA gyrase. Okay, so that's the mechanism of action of nalidixic acid. It's an inhibitor of DNA gyrase. As a result, the replication would be inhibited. It causes some adverse effects. Like it can cause a rash. It can cause blurred vision. Okay, it can cause nausea and vomiting. It can also cause diarrhea. Okay, so those are the adverse effects, okay, of nalidixic acid. So what about nitrofurantoin? Let's take the next one, nitrofurantoin. So the important points to remember about nitrofurantoin is it is a broad spectrum. It is broad spectrum. So what do we mean by broad spectrum? It is effective against both gram-positive and gram-negative organisms. And it basically damages DNA. That's the mechanism of action. Damages DNA, leading to strand breaks. Okay. It is well absorbed. We can give it along with food. Okay. It can be administered with food. So bioavailability basically does not change when it is administered with food. So it is again used for uncomplicated UTI. Okay, the adverse effects would be it causes some GI irritation. So if a drug causes GI irritation, it can cause nausea and vomiting. Okay, and something related with the GI, anorexia. Okay, and it can cause, sometimes it can cause hepatitis. It is, it is excreted in breast milk. Okay, so it could be a concern with if the mother is suckling. So let's take the next drug. Next drug is methenamine. So the important aspects of methenamine is it is hydrolyzed in vivo, lyzed to formaldehyde and ammonia. Okay. This formaldehyde cross-links the proteins. In this case, we are talking about the proteins of bacteria, and as a result, it causes toxicity to the bacteria. Yeah, so the active agent is formaldehyde, which increases in the urine. So the patient should be asked to refrain from voiding. Okay, so that there will be a concentration of formaldehyde. Okay, so they have to decrease the frequency of voiding. Okay, so to gain maximum effectiveness. Okay, because the active compound which is bactericidal is formaldehyde. Okay. So let's take the next drug, fosfomycin. So what fosfomycin does is it inactivates an enzyme, that is called uridine diphosphate N acetyl glucosamine 3 enol pyruvyl transferase. Okay, that is involved in cell wall synthesis of both gram positive and gram negative bacteria. Okay, so that is the mechanism of action of fosfomycin. Okay, so it is given per oral and it is absorbed, and the activity persists for about 24 to 48 hours. Okay, so that is fosfomycin. Okay, so mandelic acid, the point is that mandelic acid is also broken down to formaldehyde. Okay. So this is the active bactericidal agent. Okay. But of these two drugs, this ammonia, it is toxic to the liver. Okay, so that's the problem with these drugs. So it forms formaldehyde plus ammonia. This ammonia is toxic to the liver. Okay. So that is the first class of drugs that we have talked about, which are urinary antiseptics. Okay. So now let us talk about which drugs we are going to talk about. Antimicrobial drugs. So, antimicrobial drugs again can be classified. We have said the UTI is caused by bacteria, fungus and viruses. So there will be antimicrobial agents can be antibacterial, they can be antifungal, and they can be antiviral. Okay, so yeah, so what did we talk about? Antifungal and the organisms causing UTI, the fungus and the viruses, they are found only in immunocompromised hosts. Okay, so therefore the drugs which are used, let's write it down here. The antiviral drug that is most commonly used is cidofovir. Okay, the antifungal drugs that are used are fluconazole, okay, which is given per oral drug. Okay. The other drugs that can be given is amphotericin B, and flucytosine. Okay, but these drugs have got lots of adverse effects. So the drug of choice, which is given for UTI caused by fungus, is fluconazole per oral. An antiviral drug, the most important and most clinically useful one is cidofovir. So what we need to remember here is the viruses which cause UTI usually cause hemorrhagic cystitis. Okay, so if there is massive hemorrhagic cystitis, then we need to suspect viruses as the causative agent. It should figure higher in the differential diagnosis. Okay, so let's talk about, and as we said, in the immunocompetent host, UTI caused by by bacteria is the highest. Therefore, we will look at antibacterial drugs in some detail. Okay, so let me write here again. Antibacterial drugs. Okay. So antibacterial drugs are administered in different regimen. Okay. They are administered in different regimen. Okay, so here what we need to remember is this antibacterial drugs that we are going to discuss now, they are used only for uncomplicated UTI. Okay, so for complicated UTI, some other drugs are used. So let's take the important spectra of UTI. Let's take for cystitis first. So cystitis again, what is it? It is the inflammation of the bladder. And the first choice of drugs, so the first choice, okay, so let's write first choice, let's write second choice, okay, and then let's say for pregnancy. So the first choice of drug for cystitis is trimethoprim. Okay, and we said it is a regimen. So the regimen is 200 milligram BID, okay, twice a day, and nitrofurantoin. Okay, nitrofurantoin is 50 milligram 4 times a day. The second choice would be, the second choice of drug is cephalexin. Okay, and because it is a regimen, again this is 250 milligram 4 times a day. Okay, cephalexin, there is ciprofloxacin. Ciprofloxacin is again 250 milligram BID, okay, 2 times a day. And then there is pivcilinam. Okay, this is 400 milligram TID. Okay, 3 times a day. Now these drugs, they need to be administered into 3 days. Okay, in females. And they need to be administered into 7 days for males. Okay. So in pregnancy, the drug is nitrofurantoin again. and cephalexin. To 50 milligram QID 4 times a day. 250 milligrams. This is again QID. Okay, but these need to be given for 7 days. Obviously, it is for the females because they are the people who get pregnant. So that is for cystitis. The next one that we could look is, after cystitis, the most important disease is pyelonephritis. By the way, the first choice, trimethoprim and nitrofurantoin. This is the regimen that is given for prophylaxis. Okay, what is prophylaxis? Means for prevention. Okay, so prevention for to prevent relapse. Okay, so there are two things that we need to remember here. So let's go here. Oops. We need to know two terms. One is called relapse. Okay, so what is relapse? It is the recurrence infection. Okay, relapse is recurrence of infection within 7 days of stoppage of treatment with the same microorganism. Okay, so this is relapse. And then there is recurrence or reinfection. Let's write it better as reinfection. So reinfection we define as the recurrence of infection after 14 days. Okay, recurrence after 14 days of stoppage of with the same or different microorganism. Okay, so yeah, so prophylaxis is usually we are trying to prevent the relapse. Okay. So we were with pyelonephritis. In pyelonephritis, the first choice would be cephalexin. Okay. So here 1 gram QID into 14 days. Okay, so this is a more serious infection. Okay, pyelonephritis. So that is why 1 gram is administered, or ciprofloxacin. It's given 500 milligram, or double the dose here if you look at it. Okay, so that is for pyelonephritis. pyelonephritis. Okay. And the other drugs that can be given for pyelonephritis, the second choice would be gentamicin and cefuroxime. Okay. Gentamicin, cefuroxime. This is again 750 milligram to 1500 milligram TID. Okay. Into 14 days. So this gentamicin, it has to be titrated, okay, according to the renal function of the patient in pyelonephritis. Okay. So now let's look at antibiotics which are given for the males. Okay, male infection. So the male infections that we're going to look at is epidemorchitis. Okay. And the drug is ciprofloxacin. 500 milligram BID. In young men, doxycycline. That's right. Young men. Okay. So that is given 100 milligram BID. And in older men, ciprofloxacin. 500 milligram BID. Older men. This whole thing should be given for a period of 14 days. So the other infection that is seen in males is acute prostatitis. Okay. So the first, the drug of choice would be trimethoprim. 200 milligram BID twice daily. And second choice is ciprofloxacin, 500 milligram BID. But the thing with prostatitis is it has to be given for a very long duration of time, 28 days, to clear up the infection. Okay, so these are basically the antibacterial drug regimen for cystitis, for pyelonephritis, and for the male infection, epididymochitis and acute prostatitis. Okay, and so we branched from here. So antibacterial drugs. Okay. So let's come back to where we began. So we set out to learn the drugs used in urinary tract infections. We talked about the introduction. We have defined what is a UTI, and we talked about the spectrum of UTI. So what's the spectrum of UTI? It is from asymptomatic Okay. Two, which is the first one? Yeah, urethritis. Okay. Then the bladder cystitis. Then ureteritis. I got this spelling wrong. Ureteritis. And the kidney infection is called pyelonephritis. Okay, so this was the spectrum that we discussed, and we talked about the drugs used. We have talked about the drugs used in the major infections. We have talked about infections in males as well as females. Okay. So with that, let us conclude this lecture.